like to highlight a few things, and especially in comparison with what I have seen in Israel. In Israel, the pharmacovigilance system and department has been set up quite recently. And it's a young department with young people. And eventually, we have organized completely differently to analyze benefit risk of the vaccine. In fact, 90% of the medical data are digitalized, meaning that everything is in the health record. Everyone is in one HMO, in one of the 4 HMO. And at the beginning of the vaccination and also the corona pandemic, they have set up an epidemiologic database that was in relation linked to the 4 HMOs. In the healthcare record, the electronic health record, you have everything for 20 years about all the results of the patient in the medication he has taken, the RX or MRI results. So we have everything. So in fact, all the HMOs and the Ministry of Health have been able to analyze both the data on vaccination, the numbers of vaccination, and also the efficiency and also the safety. And it's almost in real time, meaning that a spontaneous report are playing a very less important role. Because the most efficient is this epidemiologic data, which is working with artificial intelligence. And so we are able to retrieve the information in a very, very quick way, which is, I think it was the first publication, I think it was in April. It was the first publication of on the efficacy and safety of vaccine in the world, I think, with the Pfizer vaccine. The other difference that we have with all the what you have presented is the fact that we have used almost only the Pfizer vaccine. I think it was certainly a deal also to obtain the amount of vaccine immediately, was that we were able to provide this data, which were very precious for Pfizer, and not only for Pfizer, but the whole community. And then we have different, of course, we have different information, which means that, do you think that we will evolve towards this epidemiologic aspect of the pharmacovigilance, which will be more and more, first of all, we will have better information, more information. It will be related to the patient record, so we will be able to analyze the causality assessment better. And so this is one of the things that I wanted to put in front of your experience. I have 2 other things about the social media. I have been in contact in Israel with a startup, a very young scientist in artificial intelligence and machine learning, and she has developed a solution to screen not only the database like the VGBase or all the databases that are available, and also literature, and also all social media, and to screen all the forum and the chat and everything. And what is very sad, it's something that she has developed about 5 or 6 years ago. She was not able to find people interested in that, which is, I think absolutely incredible. And this young scientist and CEO of this startup has been obliged to close this company, but she still has all the knowledge and the experience and the software. So I think that this is something that we have to encourage and perhaps to try to find these people and to find a way to use this incredible thing. And then last thing, I wanted to just about, it was about Adalton, your increase in the, I don't remember if it was Raquel or Adalton, you had an increase of the percentage of serious adverse event at the in the time. I think it was Raquel. And I think that perhaps it could be done. It could be due to the fact that at the beginning people wanted to report everything, and at the end they were. Everyone knows that there are some headaches and pain on the place of the injection place. So it's certainly due to this. People are more reporting adverse events than
certainly, Irene. This is the explanation that is stated also in the reports, because at the beginning of the vaccination, the reports fever, myalgia, headache, like a flu syndrome, were absolutely the majority. And after this, people assumed that these effects were the effects of the vaccines and reported in proportion more serious events. That is useful also because in the first times, the sensibility of the system contributed to the knowledge of the effect of the vaccine. A vaccine that has been not authorized, it is not authorized in Europe and by the WHO organization. And it was crucial to know how does it work.
Yes, of course.
Yes. And after, of course, people reported in proportion more serious events. And with the other vaccines, you can see the notification, the reporting rate is not so high. This is normal.
So, Adalton and Adil, I would like to have your reaction about the evolution of electronic health record, how it is in your country, and also Raquel, and also how you see the evolution of the reporting of the spontaneous reporting. We know that we have a very low level of reporting. So the solution is, of course, it's epidemiology. So I would like to have your reaction one by one in your country and how you see the future.
In Brazil, the electronic system, it's totally working. The electronic platform, there is no reporting the paper. I have this question about Raquel and Adela, see if your countries there is reports in papers forms or just electronic, but Brazil is just electronic. As I think is the pattern of the report is the same of the others, the drugs or vaccines.
No, my question was something else. Are you going to the epidemiology, to the health record of the patient to retrieve the information? Before people were, without people reporting?
Yes, Irene, this is one of the inequalities of between developed and underdeveloped countries, because here we cannot have the electronic resources and not only electronic economic resources, and the political will to do this. Because here there are records, health records, of course, but for instance, in Argentina, we have a very overlapped, fragmented and overlapped system, care system, because we have a public system and a private system. And we have, for instance, the health coverage for retirees, but people, there are people who never contribute to this healthcare base. And this healthcare base is used in very few cases, and I can guess with many obstructions, because it's a matter of political, and for private databases that they could take advantage of this, they don't want, because it is costly, and they don't see the private sector. It doesn't act with public health vision. That is so. Lack of resources, a fragmented system, and lack of knowledge. The lack of healthcare databases for working on. They are wonderful, but we don't have it. We have fragmented and private system, and the public system is not so transparent. So,
okay. And what do you think, Adalton?
Answer or question. One patient receive vaccine in Brazil is registration in the system. The name is ESUS in Portuguese. And inside the system, there is a possibility to report adverse events. So all patients that receive vaccine is registration in this system. So it's possible to make a crossover study in the follow to observe, for example, late events for vaccine. It's possible to make a crossover using this database ESUS, and the patients in the receive this information about the hospitalization in the future, or to use a new medicine, for example, to treat a cardiac disease. It's possible to make epidemiological studies using this database. It's possible because all information is recorded. Okay.
When you do it, are you doing it? You say it's possible to use it.
No, it's possible to use. It's possible. It's necessary effort to make this study, but it's possible because this information is registration, and you talked before about the artificial intelligence. It's the time for using this information, because there are the base is very strong for make studies on the future. It's not building a cohort different of the other countries, but this database is possible in the scenario of pharmacovigilance used for follow patients, make this crossover, because the vaccination in Brazil happened all totally in the public health system. So it's possible just one database.
Okay. And Adela, what is the case in your country?
In my country, I have partial information in the electronic record. The information that I have is the information that we want to use, or we are working to use for our next step, our next study, is hospital discharge. I have hospital discharge for all the system. And with this information, I can find, for example, the background. And I'm working on that with the Ministry of Health now. But I don't have, for example, in the electronic record, the information of the exams and the other information of the chart. But I have the hospital discharge, and with this information, we start to work on that in this.
Which is already something.
Yes, of course, we are glad for do that. And it's our dream to have all the system in one database. I hear you, and I like have the system like that, when I can have all the information in the electronic and do a lot of study. But for us, it's something similar that Argentina, our system is also fragmented in private and public system, and every sector building their own system, electronic system, and you need to do a lot of bridge to have all this information in one database. But for now,
Yes.
I have something, and I will do something with the something I have.
Great.
Yes, anyway, I would like to emphasize the effort and the success of these governments, and because Chile has more resources than Argentina has at that moment now, and I don't know Brazil, but we are not rich countries. So the effort to vaccinate population, like Chilean did in 2 months, 90% of population, they are many. It's true.
Mhm.
We have to deal with money, with cost of the, for instance, the Pfizer vaccine, the vaccine. All the opposition, the politicians of the opposition made lobby for the Pfizer vaccine because it costed this double or triple than the other one. And in fact, the economic trade or deal, I don't know how is the correct term, was reached 10 months later. And there are many economic questions for countries, for poor countries, for under-resourced countries. And this, I think, that the result, we can see this as a second. We have 127,000. But the government made the effort. And I would like to emphasize also that social distance is a very effective and for free measure. I don't know if it's totally and completely for free, but vaccines are good, but vaccines are not enough. Social distance must be maintained.
And now that we see the sixth wave, I don't know how you are in the BA2. I think that it has not reached Latin America, the Omicron. The
Omicron.
BA2.
Yes, the Omicron. Omicron,
No,
we had the Omicron wave.
No,
yes.
The BA2.
I know BA2, no.
No, because right now in Europe it's increasing, then it's stable and starting to decrease, and now it's starting also in Israel very late.
Until now, there's no but.
Okay,
I hope this scenario is keep, but it's very difficult to keep this zero.
Yes, absolutely, and we see in Hong Kong how difficult it is to stay in zero COVID. You know, in being together and discussing this, our differences and the way we have reacted to this pandemic, every one of us, we have tried to be active and to be proactive. I think that we could set up like a small network and exchange what we have done, all of us, and when we have to translate in one language or another language, it's something that we can do to help each other. So I'm just sending this idea right now to set up a small network, a small group of people to exchange what we have done each other. So whoever is interested will be more than welcome.
That's right. Well, I think that if there are no more questions, we can close. Irene.
Yes, I think that there is a lot of questions which remain to be addressed, but I don't think that we will be able to do that in one session. So thank you, Raquel, for bringing such good experts, and thank you to you for organizing this Latin America, the two parts. It was very interesting, and I would like just to have few slides to finalize this session. Just perhaps a few words about who we are, the ERANIM, the association, which is the mission is to promote the safe medication practices and to give more science-based information on vaccines and to fight infodemic, of course. We have decided to open our activity not only to healthcare professionals and experts in pharmacovigilance, but also to the general public. We want to be a public health actor in the crisis and pandemic, and we want to increase the collaboration between all the countries and between Israel and the international community. We are very proud to be the 101st member of the Vaccine Safety Net. We have set up a very strong partnership with the Global Pharmacovigilance Society and its journal. So all our events are promoted and supported by the Global Pharmacovigilance Society. And I have been very glad to be elected as a foreign correspondent for Israel in the French Academy of Pharmaceutical Science. And it's not only me, but I think it's something which is also for all the task force and the role of Israel. And this is our team, which is a great team of experts and people from all kinds of disciplines. And just to tell you that we have a website when we have question and answers and articles in English and in French. We have also set up groups, WhatsApp groups, in which we are sharing the literature survey and the press review in English and in French, meaning that it's without comments, it's only pure information. So that because we are doing the literature survey, we are just sharing it. And the next COVID vaccine around the world will be for Europe in April and May, so don't miss it. And if someone is interested in setting up this small network or think tank, whatever, to share the way we are working, I will be very glad to collaborate with you. So thank you very much. Have a nice day. And hope to see you for the next webinars. Bye-bye.
Thank you very much. Au revoir.
See you. Bye-bye.
Thank you for the invitation. Bye-bye.
Bye.
Thank you.